Hello, everyone. I am Dr. Jeleni Marquez, and I'm really excited to welcome you to Psychopathology and the Role of Social Worker. I wanted to offer a little bit of an introduction of myself and then go a little bit into what you'll be learning in this class. So, professionally, my background sits in the intersection of psychology, social work, behavioral health, trauma-informed care, and crisis intervention. I hold a doctorate in clinical psychology, and I'm also a licensed clinical social worker. Across my career, I have worked in law enforcement and forensics, clinical practice, behavioral health consultation, psychotherapy, and academic leadership. I think that psychopathology is an interesting topic, an interesting area to approach with both, clinical seriousness and deep humility. In practice, understanding symptoms in diagnosis is important because it helps us recognize what a client is experiencing. It helps us to identify appropriate interventions and communicate with other professionals to develop a interprofessional team to be able to provide services, right? So a diagnosis should never reduce a person to a label, but more so it should add to that experience and to be able to be part of a much larger human story. My clinical experience has taught me that symptoms don't exist in isolation. In this class, you'll learn that mental health concerns are deeply shaped by culture, race, poverty, family systems, medical history, substance use, community violence, all the things that make access to care open for some and available for some, but more challenging for others. As social workers, we have to be careful not to rush to conclusions and or assume that a diagnosis explains the whole person. So in this class, you'll be able to think critically about how major mental health illnesses are assessed, how they're diagnosed, but also how power, bias, stigma, culture, and systems influence that process. So my goal for you is to look at this class with more of an open mind, to be curious, to apply clinical reasoning, and to be confident with what you're learning and to be able to engage with others. Strong social work practice requires knowledge, curiosity, cultural humility, self-awareness, and professional integrity. I want you to learn how to ask better questions, consider context, to use the diagnostic tools that you'll be learning here, to use them responsibly and honor the dignity of every client in front of you. So as we begin, just really look through all those topic content areas and become familiar with all the different things that you'll be learning. So I'm excited to have you here, and I'll see you in class. Bye-bye.